have a replay of this week's lecture, it's provided for you. Just click on the link up at the end of the slideshow. Unfortunately, I haven't been able to. I'm not able to modify the sizes of the or the windows that I'm sharing, and oh, so we're going to do it like this again, still again, until I can figure it out. Now, let's continue on with our discussion from yesterday. Where were we yesterday? We were supposed to talk about clinically important fungal species, and this would include your dermatophytes, specific systemic mycoses, and what other organisms are there? Systemic mycosis, opportunistic mycoses, and many other organisms that we will talk about today. But this will be just a quick one because we're going to continue on with virology later on. All right? Is that okay with everybody? Okay ba kayong
Yes, sir.
lahat? Ay, kailangan
Yes,
mag-Tagalog pa ako
sir.
before pa silang sumagot. I'm sorry if I'm delivering the lecture in English because most of the questions that you will encounter will be delivered in English as well, and therefore I will have to help you out in terms of the language barrier as well. Hang on a sec. Okay. So,
Sorry po.
can you guys see my monitor or no? You can't see my
Yes po. But
There's no slideshow, right?
Yes, sir, we can po.
there's no slideshow po.
Okay.
There.
Okay. All right. So, quick recap. What antibiotics are added to a fungal culture media? Quick recap. Anybody? Anybody can answer? Mute or unmute yourself. It's not a problem at all. What? Nobody? Starts with two C's. So this is our lecture for today. Medical. So by the way, the answer to my question previously is cyclohexamide and chloramphenicol. Chloramphenicol prevents the growth of bacteria, whilst cyclohexamide prevents the growth of saprophytic fungi. All right, so medically important fungus. We're going to start with dermatophytes. So there are three species of interest for us. Usually in the board exam, they will ask you questions such in this way. Um, which of the following is a dermatophyte? Which of the following can cause an opportunistic infection or an opportunistic fungal infection? So that's the reason why I'm trying to condense the material in such a manner that you'll be able to understand some of the questions and how to tackle on some of the questions, and also how to tackle on the board exam or any preliminary exams that might be in this particular format. So for those people who are new, I don't think there's anybody added, but just for me to introduce yourself, just to introduce myself, my name is Manuel. I am certified by the ASCP as well as the Professional Regulations Commission because I am an RMT. Anyway, let's move on to our dermatophytes. So epidermophyton, trichosporon, and microsporum species are the ones that we need to talk about. Um, dermatophytes are or sorry, dermatomycosis is commonly known as what you call the ringworm. The medical term for ringworm is what? Anybody? I assume everybody has a copy of the lecture. So answers? Anybody? Answers? Answers. Okay, wonderful, wonderful. I want people to at least participate. Yeah. What cyclohexamide? Some Adrian. I think Adrian sent in his answers late. But anyway, um, the medical term for ringworm. Anybody? Anybody? Rona, give it a shot,
Pinya
Ron.
po.
Right, wonderful. But sir, you might be asking me, what? Why is it called tinea? I remember, sir, when I was studying in my third year college, I took up the course of parasitology, and there was two species of organisms there that I could vaguely remember the names, but I know they're worms, but they're not. But in this case, why is tinea considered as a fungus? Well, why is the medical term for ringworm a fungus? Is it really a worm? It's not really a worm, guys. Please don't forget that tinea is a term that is derived from, I'm not sure whether it's Italian or Latin, but tinea is the term used by early physicians because of the fact it causes it causes circular patches in the skin. All right, so please don't confuse it with your parasitology questions or with your parasitology lectures, which involve Tinea saginata and Tinea, Tinea saginata and Tinea solium. All right, this one is different. Okay, so when we say ringworm, this is actually just a fungal infection, or a the medical term for it is tinea. All right, wonderful, guys. Somebody answered. Thank you so much. All right. Next, we're going to move on with the common names of the following. I want people in the chat room um, to help me out here. I have trouble remembering these names. Tinea pedis. Pedis means the foot. So, what type of ringworm do you have when you have Tinea pedis? Anybody in the chat? Anybody? Oops. Anybody? Chat or unmute yourselves. Um, if nobody will answer, I'll try to call out some of the names here. Let's see whose names I haven't called on yet. What about Cesar? I like Cesar's name. Cesar Makatulad. Cesar, are you here with us? Cesar is not here. Cesar, hello. I oh
Sir, nagsasob lang daw po siya.
I okay, okay. All right, let's try with another person. What about Reniel Christian? Reniel Christian, can you help me out? What is tinea pedis in layman's terms?
Uh, Wait, sir. Tinea pedis po in layman's term.
Yes, tinea pedis. Tinea
Um,
pedis.
Athlete's foot po.
Oh, di ba? Wonderful. What about tinea cruris?
Tinea, sir, I also get a hard time pronouncing them po.
Tinea cruris. No, don't worry. Don't worry. It doesn't
Jack,
matter how you
Jack,
pronounce it.
ano po, sir? Jack itch po.
Also, where would you find it in the body?
Ano po siya, yung red and itchy rash po in warm and moist areas of the body.
Yeah, what
It can be in
specifically
like,
what part of the body? I'm asking which part.
siguro po sir, in my case, it may be found around my ano po, shoulder,
Oh,
near my shoulder
oh,
po.
sorry. Terribly sorry, but we have to go to another contestant. Somebody is raising their hand. Francis. Thank you so much, Raniel, for playing. All right. Let's go
Thank you
with
po sir.
Francis. Let's go with Francis.
Uh,
Where would you find Trinia
I think
cruris?
sir in the groin area, sir.
Okay, wonderful. Guys, don't forget, Tinea cruris is maarte term for what? Hadhad. Di ba? Lagi yang ano sa atin. Lagi yang, it's a very common commercial. I think, I forgot what the commercial was, but Nizoral? No, Nizoral. Yeah, I think so. It's a cream. It's a cream that people, that is always advertised in the Philippines. All right. So let's move on with the next topic. With the next one, tinea capitis. Capitis, which means in the head. Tinea unguinum or unguinium, however you pronounce it, because it doesn't matter because the exam is in multiple choice. So don't worry how you pronounce it. So long as you know the idea, tinea unguinum is where anybody in the chat or voicemail. Somebody's raising their hands. What about Adrian? Oh, Adrian, first time ko nakita nag-raise ng hand
Sa
si
nails
Adrian.
po.
Sige. Sige, go,
Sa
Adrian.
fingernails po.
Fingernails, yes. Wonderful. And then, who else is here? Tinea corporis. All right, Tinea corporis is anybody? Chat or voice? Doesn't matter. Ayan. Okay, okay. Who's there? Okay, okay. Body, yes, body. Wonderful people, wonderful. Noreen, thank you for participating. This is the first time I've seen you today. Even yesterday I didn't see you. But yeah, thank you for participating. All right. Now, let's move on. This is the answer to those questions. Jock itch. All right. Scalp ringworm, body ringworm, nail ringworm, and so on and so forth. Now, what fungi is associated with tinea? Well, there are several types. So we're just gonna go over them quickly. Trichophyton species, because there's a lot of that trichophyton species, and I don't want you guys to get confused because we already talked about it yesterday with the culture media ones. We have Trichophyton mentagrophytes and Trichophyton rubrum. We also have Microsporum canis and Epidermophyton flucosum. Epider. See, See, I'm trying to modify my own lectures because as I move on, as I as I see some of the typographical errors. So Epidermophyton flucosum. All right. Next, let's move on to fungi associated with Piedra. So black Piedra and white Piedra. Black Piedra is caused by what? Anybody in the chat? These are common questions that are usually asked in examinations in when I was in college. Usually they ask this in preliminaries, blah blah blah, and even in some finals. So Black Piedra, these are must know ones. Piedra Horte. All right, people are participating. What about White Piedra? What about White Piedra? Anybody? Voice. I want voice this time. I want people. I want to hear people's voices this time. Piedra, Trichosporum. Somebody said Trichosporum. All right, so we're trying to challenge ourselves. We're going to give you guys the answer. All right, so the answer is Trichosporum or Asahai. All right, doesn't remember? Don't remember. It's not how you pronounce it, but you have to remember the name, of course. Okay, Trichosporum Asahai is also known as Trichosporum vageli. It was renamed, I think, in the 2010, if I'm not mistaken. So when I took the exam, they were still referring to it as Trichosporum vageli. But then when I went to the question bank in the Board of Certification in the United States, the I was shocked when I saw Trichosporum asahi. I said, what the heck is Trichosporum asahi? And then when I searched it on Google, it was Trichosporum vageli formerly. So please don't forget these two organisms because they are considered to be um, hair infection. They're relatively common in tropical countries, particularly in the Philippines. A lot of people, especially those who have lack of who are lacking clean water, they would have these types of hair infections. All right. Okay. So I'm gonna leave you guys for a couple of minutes. Um, let's try to go on. Let's try to at least make what do you call this? Make a sort of review on some of the questions in this slideshows. All right, if you guys have it, I'm gonna give you guys a couple of minutes, like 5 minutes or less, because I have something else to do for a while. Hang on a sec. All right. Like, can you guys give me like 5 minutes or 10 minutes?
Sige, sir.
Okay. So try to answer some of the questions in the slideshows, and then when I ask the question later, um, I hope you guys can participate. right, so I'm back. So is everybody still here?
Yes, sir.
All right. Okay. All right. Let's move on. Oh, somebody answered Trichosporin as a high. All right. Wonderful, Anna. Wonderful, Anna. All right, but it was a little bit too late when I saw it. So terribly sorry. All right. Let's move on with the distinct morphological characteristics of dermatophytes when they're observed in the KOH prep. Remember, what percentage of KOH prep do we use again? Anybody? Just quick answer.
10%. 10%.
Wonderful.
10%.
Okay, wonderful, guys. Wonderful. Okay, so at least we're learning something from that is actually important in the board exam. All right, so they are the distinct morphological features of dermatophytes when you observe them is they have segmented hyphae. All right. So aside from Aspergillus, you're going to see dermatophytes. You're going to see dermatophytes in the hyphal form as segmented. Okay, and we're going to talk about Aspergillus later. What about Fertinia versicolor? This is known as multicolored ringworm or body ringworm. Some people might some references calls it. So what is the causative agent of Tinea versicolor? It's a pretty common question, I think, in the board exam.
Malicia furfur po.
All right. Or you could say emperor if you're having difficulty, but again, that's correct. Wonderful. Thank you. And how do we remember Malassezia furfur based on microscopic analysis or microscopic observation? How would you characterize Malassezia furfur? What do we normally eat? Or it's almost Christmas, guys. What do we normally eat in Christmas? Let's try and ask people in the chat. Charisse. Charisse, hello.
Hello, sir.
All right, hello.
Spaghetti and meatballs.
Aywa, ayan, I love it. I love it. Spaghetti and meatballs. All right, by the way, guys, please don't forget that Malassezia furfur is an organism that is also the causative agent of dandruff. Okay, and this is actually the target of Head and Shoulders to be to be specific. Okay, so if you have Head and Shoulders, this is just something that I watched. If you're familiar with Dr. Mike, he is I think a
Yes, sir.
famous influencer. He mentioned that Malassezia furfur is one of the causative agents of dandruff, and this is an organism that loves our hair, specifically not specifically our hair, but rather the sebum that is in our scalp, and they thrive on that particular substance. Okay, so not only does Malassezia furfur cause tinea versicolor, it also causes dandruff, and it is also the target of Head and Shoulders. Diba? Self-promotion. All right. Self-promoting din ang ating lecture. All right. What is the microscopic appearance of the organism that causes tinea versicolor? You all guys already answered it. The answer to that question is spaghetti and meatballs. Unfortunately, I don't know where my picture is. I was supposed to give you guys a picture of it, but yeah. Anyway, let's move on. Malassezia furfur will produce what color of fluorescence when exposed to wood lamp? All right. This will produce a yellow
Yellow
color.
fluorescent.
Has anybody actually seen what a wood lamp is? Anybody? Um, Basically, it's like a ring light. All right. So it's like a ring light that how do I characterize? Ah, yeah, it's like a ring light, but the light source emits UV rays. And when the person has Malassezia furfur, or we want to have a rapid diagnosis of this organism, we use the Woods lamp. Okay, Woods lamp. It's not actually wood lamp. I saw some lectures in some of my previous students before. It has what you call wood lamp, or I was thinking it was a lamp made of wood before when I was a student. But when I entered the practice, I realized that some of the dermatologists they have what you call the Woods lamp to basically screen for fungi, and It's like the ring light that you guys are so familiar with, especially with social media influencers. But the light emitted by Wood's lamp is UV, and Malassezia furfur will produce copper color or yellow lesions, as some of you guys have mentioned already. Now, we're going to talk about dimorphic fungi. Quick question: what is the meaning of dimorphic fungi based on our previous discussion yesterday? Dimorphic fungi, everybody. Francis raised his hand.
It has two forms. It's either yeast or a mold, sir.
All right.
Example, dermatitis.
Um, yeah, okay. All right, wonderful. Thank you for that wonderful answer. And we have several organisms that are included as that are considered medically important and are dimorphic. So I'm gonna give you guys 6 examples. First one is Porotrix schenki. The other one is Blastomyces dermatitidis. Third is Histoplasma capsulatum, Coccidioides imitis, Paracoccidioides brasiliensis, and Penicillium marnefi. All right, Penicillium marnefi is the latest addition to this one because it was asked, according to some of my friends who recently took the ACP exam. This is there's no other. Um, the question was for Penicillium marnefi, which of the following organism is um, which of the following organism is dimorphic? That's the only question. That's the reason why I included it here. Although not much research, especially literature, is provided, so I added it for you guys. If you are, if you're not familiar with him, this is the time you're going to hear him for the first time. This is the first time we're gonna hear him, especially for me because I recently just got it. I think a couple of years ago, 2020, 2019, when I delivered a mycology lecture as well, a couple of years ago. All right. Um, quick, and what do you call this? Quickly, we have Penicillium notatum, which is what the before we move on to the other organisms, we're going to talk about Penicillium notatum. What is the importance of Penicillium notatum for us as people who are studying microbiology, or in this case, mycology? What's the importance of Penicillium notatum? Anybody? This is a nice to know question, and it was asked in a PAMET quiz show question. I don't know if what okay, Adrian, what is Penicillium notatum?
Sir, di ko po sure. Pero dito
Okay.
po ata galing yung ano, yung penicillin po.
All right, wonderful. So the discovery of penicillin is actually from Penicillium notatum. It was a question in the PAMET quiz show, and I just wanted to throw it out there for your information. It is a nice to know question, and I don't know if it will appear in your board exam, but just so you know, it's Penicillium notatum. All right. Okay, so what phase of dimorphic fungi is seen at 37 degrees Celsius and 25 to 35 degrees Celsius, or room temperature and body temperature? Quick answers. Anybody in the chat? Quick answers. Anybody? Um, all right. Uh, let's try to ignore Adrian for a while. Let's try Lisa. Sorry, Adrian. We have to answer. We have to ask other people as well. All right, Rona. You raised your hand, Rona. What forms or phases of the fungus?
I think mold po, sir.
All right, at what temperature?
At 37. 37, sir.
Sorry. All right, let's find another person. 37 degrees Celsius. What is the phase that we're looking for? What's the phase of the organism that we're going to see? Anybody?
Yes, sir.
Yeast. All right, wonderful. Who's that one? Her voice is very cute. Love it. Myra Gagasso. All right, thank you, Myra. And the opposite of that one is the mold form, which is usually seen at room temperature. All right. So, guys, for your information, so that you guys won't forget, when you have bread, which is left out in the room temperature, it it sometimes spoils, and the reason for the spoilage is molds, right? So it's left at room temperature. Okay? Candidiasis is usually an infection that occurs in humans, and it's a yeast organism. It's a yeast. It's a monomorphic organism that is seen in the body at 37 degrees Celsius. So yeast body temperature. All right. Mold. Just remember your bread spoils because of mold, and therefore I would expect mold organisms to be present in. Oh, sorry, the presentation was gone. Um, Therefore, I would expect the mold to be seen at room temperature. All right. So thank you, Mayra. How do you pronounce your name again? Mayra or Mayra?
Neira.
Okay, so I said it correctly the first time. Thank you, Mayra. All right. Now, let's move on to the causative agent of rose gardener's disease. This is a common question in your exams, guys. If you don't know this, you're losing 1 point, guys. Anybody? Somebody typed on the chat or somebody raised his hand. Francis.
Sir, it's Sporothrix shenki.
All right.
Is that
Wonderful.
how to
Wonderful.
pronounce it?
And a wonderful pronunciation this time. Wonderful. Okay, it doesn't matter how you pronounce it. It matters as long as you know which organism it is. Sometimes it will be spelled out as Eschenki. It doesn't really matter. All right. So multiple choice questions. So a lot of your exams will be in multiple choice questions. All right. Okay. Microscopic appearance of Sporotric shenki. Anybody? Cigars. All right. So cigar shaped yeasts. Okay. So they're usually seen in the body as cigar shaped yeasts. And we're going to move on with the transmission of Sporotric shenki. Because is named as such, you will suspect that they are transmitted via what? Skin prick from the
Rose, Thomas
thorns.
Rose.
Yes. Skin or thorn prick or exposure to peat moss. What's peat moss? Is it a name of a person? No. Peat moss is actually the uh, what do you call this? The fungi that grow moss that grows in humid environments. And I saw it being packed. I don't know why they're packing it in America, but they package it in a sort of like a feed for horses, and this moss can get infected by Sporotric shenki. All right. So histological features of a patient with sporotrichosis. I don't think this would be asked in your board exam, but I added it here just for your information. Maybe it will be asked in histopathological techniques. It will form asteroid bodies on the affected tissue. There's supposed to be a picture there as well. I don't know why there's no picture. Asteroid bodies. You can just Google, you can just have a quick Google search of it because we have the power of the internet right now. But for the meantime, we're just gonna move on. All right. Histoplasmosis is caused by what organism? I've already said it to you guys. It is Histoplasma capsularum. All right. Typically, they are seen in patients who are the histoplasma organism is typically seen in the blood smear, specifically where in the macrophages. Remember yesterday we were talking about histoplasma capsulatum in the blood smear. You can see I think I have a picture of it here. Let me just pop up I still have a picture of it here. Oh no, I deleted it. Oh, I deleted it. Here. Can you guys see it? Or, no, you guys can't see it. Hang on a sec. Let's try to insert it in this slide so you guys get to appreciate what the heck I'm talking about. All right, I'm gonna insert a picture. Mm, Histoplasma looks like this. I think this is yesterday's lecture. This is from yesterday's lecture, so please don't be confused. I'm just trying to backtrack for you guys. Okay, so this is histoplasma in the and credits will go to the pathology discussion forum from Facebook. Okay, so it's a forum wherein people from all over the world share their slides of the organisms that they see. All right. What animals may transmit histoplasma through humans? Oh, this one is important. What animals may transmit histoplasma or histoplasmosis to humans? Anybody can answer for me? Francis, I'm gonna ignore you for a while because there are other students. I don't want to be labeled as someone who has favoritisms. Who has favoritism. Let's try asking other people. Don't worry, don't worry, don't worry. I still appreciate that you're participating. Let's try Winonyaha. It sounds like a name for a taxonomical name. Winonahya Lenore. Hello, are you here? All right, so she's quiet. Okay, don't worry, no pressure. Um, what about Charisse? Charisse, what animals transmit
Inhalation,
animals? I'm asking
bird,
for
bird
animals.
droppings po.
And what else? Birds, okay. What else? Birds and what? I'm asking animals, not the mode of transmission.
Bats po.
Oh, terribly sorry. Thank you for playing. Who else can answer for me? What about all right, fine, Francis. All right, Francis. What's your answer from earlier?
May same with Lazarona po, birds and bats po, sir.
Oh, okay, wonderful. I just heard her say I just heard her say birds. I didn't hear bats, so terribly sorry if I didn't hear all of your answer. But thank you for that wonderful answer. Now we are going to move on. So starling birds actually is the um, is the birds that are usually the ones that transmit the spores. So the inhalation is the mode of transmission. Inhalation of what? The mycelium? Of course not. It's the spores. All right. So the spores. What types of tissues are usually infiltrated by Histoplasma capsularum? It is your RES or the reticuloendothelial cells. All right, the RES system. Reticuloendothelial and splenic system. All right, histoplasmosis mimics the clinical features of what disease? All right, so I have this one. I think this one is an important one because they might ask you and they might present it as a disease, but then when you look at the question, when you look at the choices, histoplasma is there. So you have to be familiar with this one. I'll give you a clue, guys. This is an organism. This is a bacteria that cannot be stained by gram stain, but can be stained by acid-fast bacilli staining or AFB staining. It will be acid-fast, and it will grow on LJ medium. LJ medium. Francis, sige na nga. Baka magtampo sa
Um,
akin si Francis.
okay lang po, sir. Tuberculosis po, indices
All
po.
right. Okay, so this will mimic the clinical features of
May bacterium.
tuberculosis. Yes, Mycobacterium tuberculosis. Um, that's the reason why I added here. I don't really like to present clinical features in most of my lectures because it just confuses students. What's the main focus of medical technology or laboratory science is diagnostics. So we're more focused on that one. But examiners oftentimes forget that we're not pathologists and they would sometimes give questions such as this. All right? So if they give you a question like that, if they give you questions like this, at least at least you're familiar that not all organisms are the same. And the histoplasmosis is different from Mycobacterium tuberculosis because in the peripheral blood smear of patients who are infected with Histoplasma capsulatum, you will see that in their macrophages or neutrophils or monocytes, there's the presence of yeast cells. All right, because again, histoplasma is what? Is dimorphic. Okay, And the only thing that we will see is yeast form. So it will mimic the clinical features of MTB. What are the clinical features of MTB? Night sweats, what else? Sudden loss of weight, coughing, productive coughing at times, and then what else is there? Um, hemoptysis, of course, is another one. Okay, and it's and we're not going to forget about the fact that there is what you call consolidation in the radiomicrograph. So when I say consolidation, it's basically just a formation of it's just a opacity in the X-rays, and we're not going to talk about X-rays because we're focused more on ourselves as a profession of medical technologists or clinical laboratory scientists. All right, histoplasmosis is commonly acquired in where? Commonly acquired in what places? So we have bats, we have starling birds. Starling birds and bats usually come out at night, and therefore they're seen in nature in what places? In caves. All right? Just to remember, guys, just for you guys to remember, saan ba nakatira si Batman or saan ba ang headquarters ni Batman? Nasa Batcave, di ba? So please don't forget that one. All right? Let's move on to another organism. This is blastomycosis. As I mentioned before, this is an organism that is called this is a disease caused by blastomyces dermatitidis. All right. The yeast form of blastomyces dermatitidis is characterized as it is characterized as the yeast form, people, thick-walled thick-walled yeast that looks like a compass, or you can say a single bud. Okay. All right. The photo credits are from the American Journal of Medicine, entitled "Blast from the Past." All right. Quick question. Anybody knows what stain we used here from our discussion from yesterday? Anybody? Can anybody remember the stain that we used here in this particular picture? It's color green. The fungi is stained black with a rosy or pinkish tinge. Anybody? Anybody? Aside from Francis, because I might look like I have favoritism. What about Noreen Fortunato? I like your name. I like the I like everybody's names here. What stain do we use in did they use in that one?
Sir, I think electricity po. Ay, teacher.
It's not blue. So we have three stains there. I think we have a lot of stains that we talked about yesterday. You can go back to your notes from yesterday. Don't worry, Noreen. All right. We're gonna hold you on the line until you figure out the question. All right, Noreen. I will come back to you later until you remember the question. All right. Until you remember the
Okay.
answer. All right. You have several minutes to check out what stain we used here. So again, this is a stain that stains the other cells or elements as green, except for your fungus. The fungus is stained as black with a pinkish or rosy tinge. All right. So if anybody could help out Noreen, they could type it on the chat, or if nobody wants to help her out, it's not a problem at all. All right, let's move on. Okay, how is blastomycosis transmitted to humans? Again, inhalation of spores. Okay, skin lesions of blastomycosis are often mistaken for what dermatological disease? It's often mistaken as cancer, skin cancer, specifically squamous cell carcinoma. Okay, so skin cancer. Okay, now let's move on. Before we move on to coccidioidomycosis. See, even I am having trouble sometimes pronouncing the words here. See, namanahawaan na lahat ng ano ko, ng pronunciation ko. All right. So, Noreen, have you gotten your answer?
Sir, try silver stain po.
Silver
Not
stain, specific.
sure.
We're gonna be specific. Oh, somebody already answered. Noreen. Adrian answered methenamine silver. So thank you for helping her out. So at least I know, at least I can sleep at night knowing that Noreen has a friend in this class. All right, I can go to sleep at night knowing that, at least she has one friend in the class, and that's Adrian. Thank you, Adrian, for helping her out. All right. Ay, walang ganon. Ano tayo dito? Professional tayo dito. Walang love team na mangyayari. All right. The causative agent of coccidioidomycosis is Coccidioides immitis, and another name for coccidioidomycosis is valley fever. Okay, why is it called valley fever? It's commonly seen in places like it was first discovered in the valleys, or what they call the Californian valleys. So if some of you might be lucky enough or fortunate enough to go to the United States, you might encounter this in the microbiology laboratory. Okay, it's because this is usually seen in the United States, specifically in places in near the earthquakes near earthquakes. Coccidioidomycosis is typically diagnosed by demonstrating what fungal structures. Basically, on histology, you will see it as a spherule. Okay, spherule. This is a spherule, guys, for your information. That is a spherule. And this is actually a cross section from a tissue sample, specifically lymphatic tissue. All right. I don't have photo credits of this one because it is from a public source. Okay, public source material. So I don't have to credit the owner of this photo. All right. How is coccidioides immitis transmitted to humans? Exposure to arthrospores in the soil or inhalation of arthrospores. Remember, what's the difference between arthrospores? They look like bones, right? Or hence the term arthro. They're jointed, of course. All right. So arthrospores. Coccidioides immitis is a fungal infection. Oh, I mentioned this already. Is a fungal infection that is common in what natural phenomenon? It's an infection. It's a fungal infection that is common in victims of natural calamities, specifically for earthquakes, because they are usually on the soil. All right. What about for South American blastomycosis? If somebody can pronounce the uh, pronounce the answer correctly, I will give them a reward on next week's. I will give them something on next week's lecture if somebody can pronounce it correctly. All right, Noreen.
Try po, try.
All right, pronunciation tayo ngayon. All right.
Okay. Paracoxoid. Ay, sorry, mali.
All right, take two, direct, take two. All right, again,
Ito po.
audition for, imagine this is an audition for Pinoy Big Brother. And the thing that they want you to do is pronounce the answer to this question. Again, direct, take two.
Try po ulit.
Okay.
Um, Paracoxicoides brasiliensis po.
Uh-huh. All right. We'll find another person. That's the correct answer, but we'll try with another person. Who else wants to challenge Noreen's pronunciation? Ah, nobody wants to challenge. What about yung collab team niya? Ah, yeah, yung collab team niya muna. Si Adrian muna.
Yes,
Noreen.
sir.
All right. How would you pronounce this?
Paracoccidioides brasiliensis.
All right. We'll try again with another person. Francis, you raised your hand earlier.
Yes po, sir. Ako po yung best naman, sir. Paracoccidioides.
Again, I didn't catch this.
Paracoccidioides.
Again, sorry.
Paracoccidioides brasiliensis.
All right. All right. Somebody else would like to challenge Noreen, Adrian, and all right, Anna Jemema. Audition for Pinoy Big Brother.
Paracoxidioides.
Para?
Paracox, Paracoxidioides brasiliensis.
Oh, I'm a little bit disappointed in you guys. Sir, can I try again? All right, try again. Adrian, take
Para,
three direct.
paracox, Paracoccidioides brasiliensis.
Oh, I'm disappointed with you guys. Pronunciation wise, you're not very you're not very good with this this one is very long. I know it's challenging. Pronunciation wise, nobody was able to nobody was able to pronounce it correctly, unfortunately. The correct pronunciation is Paracoccidioides brasiliensis. All right. So try again, Noreen. Can you copy what I just said? Paracoccidioides brasiliensis. Noreen, where are
May
you?
diin po pala, sir. Okay po, sir.
All right, direct take three.
May diin po pala, sir, yun.
All right.
Okay. Paracoccicoides brasiliensis po. Sorry po, yan.
Paracoccidioides. Direct take four. Ulit. Audition for Pinoy Big Brother.
Okay, sir. Paracoccicoides brasiliensis.
Paracoccidioides.
Ah, dioides. Sorry, sorry. Last. Ala,
Direct
sir,
take six na. Favorite talaga ni
pa na lang, sir,
Direct.
nakakaya.
Okay lang yan. Okay lang yan. Audition nga tayo sa Pinoy Big Brother eh. Alright, game. Take six na Direct. May nag-raise ng hand ba? Sino nag-raise ng hand? Alright. Adrian, sige. Love team.
Paracoccidioides brasiliensis.
Alright, at least that's close. Alright, nakapasok ka na sa bahay ni Kuya. Thank you so much for participating, guys. A lot of people were able to do it. A lot of people were not able to do it, but at least I can tell that you guys are trying to pay attention. Thank you so much for participating, everybody, especially Noreen, because I think she has the audacity, rather the audacity talaga. I think she has the charisma, uniqueness, nerve, and talent to enter the Big Brother house. All right. Okay, so what is the unique morphological characteristic of Paracoccidioides brasiliensis? This is your mariner's wheel or the captain's wheel. But we're gonna be specific. This is a single yeast cell with multiple buds arising from the center. All right. So this is what we call the mariner's wheel. All right. And with that, we're going to take a couple of minutes. I'm gonna give you guys like 20 minutes because I'm gonna check if if the laboratory has a lot of samples now. I'm gonna give you guys 20 minutes to have an advanced run through of our remaining slides, so you guys might be able to participate later. All right. So 20 minutes. Hopefully, hopefully you guys will be able to pronounce the upcoming challenges. All right. Is that all right with everybody? I'm gonna be back after 20 minutes, okay?
Yes, sir. Thank you po.
No problem. No, no, you're welcome, guys. Yes, Rainiel. Before I go, is it okay po, sir, to what? To ask for your what? UID. What do you mean by UID? Okay, okay, okay. No, after you answer some of my questions later. Okay. Okay, okay, okay. Nagulat ako kay Reniel. Nag-react din si Sir Marco, nyo on. Naloka ako. Akala ko kung ano. Don't worry, after the lecture. After the lecture,
Yeah,
guys.
I played it kasi, sir.
Later. We'll come back to that one later, all right? Maybe we could form a party. I'm in the Asian server. All right. Hello. Hello. I'm back. Hello, everybody. Is anybody still there?
Hello po.
Ayan. All right. So I'm back.
Hello po, sir.
Okay. Renial, mamaya na yung request mo ha. After tayo ng ano.
Ay, opo, sir.
Mamaya na. Paalala mo sa akin ha.
Reminder po.
Paalala mo sa akin. Kasi
Yes po,
I'm
sir.
looking for
Nakita ko
people
po
to
kasi
play with.
YouTube video,
Ay.
YouTube channel niyo po.
Those are just,
Nag-subscribe po kasi ako.
oh, tama na, Renial. You're promoting my channel. Tama na, Renial. Stop
Ay,
it. All right. Let's
sige po, sir.
let's move on to what I'm actually here for. To discuss to you guys the opportunistic mycoses. All right? Okay. So, wait. Ayoko ng ganyan. Gusto ko maganda yung pagka. Ayan, I like it this way. All right. So, we're going to talk about Aspergillus, Candida, Cryptococcus, Pneumocystis, and Mucor and Rhizopus, which this will be actually our last discussion before we move on to virology. All right. Um, okay. So this is our first what the first our first topic is Aspergillus. So Aspergillus species are monomorphic and can only exist as a mold. All right, they can only exist as a mold, and organisms that usually they are organisms that are saprophytic in the saprobes. Basically, they're just there to facilitate the decay of leaves or anything that might be found on the soil. All right. We have four species to talk about, um, but we'll talk about them later. We're going to go with the hyphal strands. So the hyphal strands are characterized by three things. First of all, they are septate. As I mentioned before, they are septate. They have right angles, and lastly, they are branching. Okay, they causes branching because when you report fungal elements, especially for microbiology reports, um, we report fungi, unidentified fungal elements as unidentified fungal organisms as such. Growth of unidentified fungal element with branching septate hyphae and this and that kind of spore. That's how we usually report it in my previous hospital. But here we don't have a mycology lab here. I wish I could show you guys the mycology lab here, but that's how we usually report it. It differs from institutions to from one institution to another. So you might be working sometime in the future in a laboratory that does that, and it's important for you guys to remember the characteristics of the hyphae or terminologies relating to reporting of the hyphae and the yeast cells. All right, so angular usually at around 45 degrees. Okay, they're not right angle, huh? Acute, I would say acute angle. In most of the notes that I've seen in the past, they usually identify Aspergillus as an organism with acute angular branching septate hyphae. Usually, those are the characteristics that they would present in exams and in notes. Okay, and the most important fungal element to differentiate the species of Aspergillus is actually the fruiting bodies or the conidophores. Fruiting bodies are the ones that we talked about earlier, previously yesterday. If you're familiar with the universal fungi, the blue picture that I showed you yesterday from the Mayo Clinic lecture that I've attended, those are the things that you would see, the ones that looks like a flower. I'll try to pop up the picture for you guys just to give you guys a sense of what I'm talking about. Where is it? We're at slide 220, so I'm gonna go back to our previous lecture yesterday, so you guys can appreciate what I'm talking about. Conidophores, this one. Okay, conidophores. So I'm specifically talking about the one with the conidia. Okay, conidia is the conidia is the spore that you're looking for. Conidophore is where the conidia grows. All right. So, um, can you see the full screen? Anybody? Hello?
Yes po.
Nakita nyo na
Yes
full
po, sir,
screen?
we can see.
All right.
Yes po.
So I'll highlight the conidophore for you guys. Let's try to highlight the conidophore. So this is your conidophore. This is actually a fruiting body. This one over here. This is actually a fruiting body. Okay? And they produce how? Sexually or asexually? They would produce asexually. Okay? So they don't need another a negative stranded. They don't need a negative stranded hyphae in order for them to survive. They can actually survive well on their own. All right. So that's the conidophore is where the conidia grows, and conidophores are usually known as the fruiting bodies of your Aspergillus species. But each and every organism that we talked about earlier has some sort of fruiting bodies. But for Aspergillus, It's the most important one because of the fact that it's actually one of the ways you can identify the species of Aspergillus. And we're not going to talk about that one because it's part of the advanced mycology lectures. And usually they don't ask these questions in the board exams in the Philippines. Okay, so you're extremely fortunate students because it is like one lecture just for Aspergillus. Each species of Aspergillus will be talked about. So we have Aspergillus niger, Aspergillus flavus. So I don't want you guys to die from boredom. So for now, all you need to know is the fruiting bodies is from the conidophores. All right. Now, what species of Aspergillus are clinically important for us? So we have Aspergillus fumigatus, Aspergillus niger, Aspergillus therius, and Aspergillus flavus. Okay, the most common one is Aspergillus fumigatus. From the name itself, you can tell that it's found in fumigation or areas where there's not a lot of heat and there's a lot of moisture for them to survive. So any area where there's fumigation devices, or rather a fumigation mechanism, they would grow there. Especially if it's particularly dirty. All right. So it's the most common human pathogen, and it's actually one of the bulk of our lectures, part of the bulk of the lectures about Aspergillus for today. The invasiveness of Aspergillus is actually due to the fact that it's dependent on the host. Low count of neutrophils and impaired functions of the neutrophils, such as in cases of patients with CGD, can actually suffer from aspergillosis much more than that of the general population. Usually all of us are exposed to Aspergillus fumigatus, but in patients with CGD um, and neutropenia, patients will definitely patients will definitely suffer the effects of Aspergillus fumigatus. And aspergillosis is rarely seen in HIV or HIV/AIDS patients. True or false? Anybody answer? This is a true or false question. Try to challenge yourself and answer the question without looking at the next slide. Anybody in the chat? I want to see everybody answer. True or false? Aspergillus is rarely seen in patients with HIV/AIDS. No, I want it in the chat. I want it in the chat, guys. No voicemails today because I want to see how many students would answer true and how many students would answer false. Aspergillus is rarely seen in patients with HIV/AIDS. All right, somebody answered true, somebody answered also false. Mayra also answered false. Rainiel answered true. Okay, hopefully you guys try to challenge yourselves without looking at the next slide because all right, everybody is there. I think everybody answered already. I'll give you guys a couple of seconds to try to answer. Okay, what else? Noreen answered false also. All right, okay. Now the answer for the, all right, I think the last one will be Noreen. All right, so the answer to the question is true. Yes, it's true. Aspergillosis is rarely seen in patients with HIV/AIDS. Why? Because because even if the patient's CD4 count is low, if the patient's neutrophil count is normal, and if the patient's neutrophil function is normal, it doesn't matter because what I mentioned before is the invasiveness of Aspergillus is based on the ability of the body, specifically the neutrophils, to repel the organism. So if you have problems with your neutrophils, either neutropenia or impaired function, sorry, wrong spelling, okay, impaired function, then that will definitely cause aspergillosis. But in cases of HIV/AIDS, even patients with extremely low CD4 count, they will have no if they would rarely exhibit the effects of aspergillosis. So that's a nice to know trivia for you guys. Okay. Let's try the another question. Transcribe ABPA. What is ABPA? Allergic bronchopulmonary aspergillosis. I know what you're saying. I know. Francis is about to answer, but I read his mind. I have a psychic link towards Francis because I know he's going to answer the question. So it's actually correct. Allergic bronchopulmonary aspergillosis. So what? So what evs? What evs, sir? Why is it important for us to discuss allergic pulmonary aspergillosis? Because in the laboratory, we can actually indirectly measure that through the use of IgE. Okay, we can indirectly diagnose allergic bronchopulmonary aspergillosis with the use of IgE. If the patient didn't eat anything that he's allergic to, if the patient was living in conditions that are deplorable, then most probably that patient would have aspergillosis. And for us to demonstrate that is we want to see the IgE levels of these patients. Okay? So I answered what your so what. All right? Next, this is the fungus ball formed in the lung cavity of patients with aspergillosis. All right? I want everybody to try and answer this question. I'll be calling out names. Let's try with the last person to answer correctly. Anna Jemima Athing. Athing or Athing? Anna Jemima, do you know what's the answer to this question?
This is the phone. No, sir.
This is the fungus ball caused by. All right, let's try another person. Try challenging yourselves, guys. Try answering the question without looking at the next slide, huh? Um, let's try the last person to answer incorrectly. Noreen Fortunato. This is the fungus
No, sir.
ball formed in the lung cavity of patients with aspergillosis. Do you know the answer?
Uh, Try na po aspergillomas.
All right, wonderful. Now, true or false, don't lie to me. Wow, di ba, Very Boy Abunda? Did you look at the previous slide? No, don't worry, it's okay. Did you look at the next slide? It's not a problem with me. As long as you're participating, I'm happy with that one. Because even if you're not actually actively reading or if you're not actually actively participating, the fact that you um, actively listening rather, the fact that you're participating is enough for me to say, oh, probably this person might learn something from this lecture. All right. Next, what are the fungal antigens that are used as an indirect? Fungal antigens can be used as what diagnostic tool? They're basically known as an indirect diagnostic tool. So another thing that you need to remember is that we have IgE, which is another indirect diagnostic tool. Then we also have fungal antigens that can be used as another means to indirectly diagnose a patient with aspergillosis. All right. So what are the fungal antigens? We have two types. galactomannan, and beta D glucan. So for laboratory people, this is something that you need to remember. All right. So we test them for beta D glucan and galactomannan. All right. What samples can be used to detect fungal antigens of aspergillosis? Oh, this one is important. This one is important because I remember this was a question for um, not the board exam. I think the ASCP certification exam. This was important. This is an important question in the BOC, the Board of Certification um, examination. It's in the question bank. So the fungal antigens the samples that can be used to detect fungal antigens are as follows. We have blood and BAL. What is BAL? Anybody knows what's BAL? Analysis of urine and bodily fluids. Review. Usually this is discussed to students at the finals, not the prelims or the midterms, usually in the finals. Anybody knows what's BAL? Charisse, what's BAL? You raised your hand.
Bronchoal
Bronchoal. Ano pa ano pa?
bronchoalveolar lavage
All
po.
right, wonderful. Thank you so much, and thank you for the pronunciation. I love it. All right, everybody give her a round of applause because I rarely hear her talk, but this time I heard her voice and I was pleasantly amused by her pronunciation, and thank you so much, Noreen. Charisse, sorry, Charisse. Noreen tuloy. Oh my gosh, I sound like I have favoritisms now. Give her a round of applause, guys. All right, so BAL, bronchoalveolar lavage. So what is bronchoalveolar lavage? These are this is something that is done by nurses. It's not actually collected by medical technologists, but nurses do it through saline washing. So when they do suction of respiratory material, or when they want to remove some excess mucus from patients who are suffering from pneumonia, as in the case of patients who are suffering from bronchopulmonary bronchopulmonary aspergillosis, or respiratory aspergillosis in general. They would also collect bowel sample. So what is lavage? Basically, this is the last collection last cleaning collection of the sample. And with that, we're going to go for another 5-minute break. Hopefully you guys will try to look at the questions for the upcoming slides. All right, 5 minute or 10 minutes. I'll be back.
Hello, good afternoon.
Welcome back
Again.
po, sir.
Welcome. I'm back. All right. Terribly sorry, there was an emergency. I had to release blood samples for a couple of patients, but that's blood bags to a couple of patients, but I'm back. All right. Okay, where were we? Bronchoalveolar lavage, right? So bronchoalveolar lavage is the collection of sample from suction samples. This is usually not done by medical technologists. These are done by nurses, okay? So you don't have to worry about it. But what you do need to worry about is the toxins of Aspergillus. Okay, and one particular species of Aspergillus is capable of producing a toxin. And does anybody know who it is? AJ Aquino, good afternoon po. Sorry I'm late. Hina po kasi ng net ko. It's okay, AJ. Don't worry. All right. So Adrian, since ikaw ang nasa unahan ng ng listahan ko, what is the species of organ
Yes,
of
sir.
Aspergillus that is capable of producing a toxin?
Um, I'm not sure, sir.
Somebody raised their hand. All right. What about Mayra? Mayra.
Aflatoxin.
No, no. What species? I'm talking about what species of organism. Listen to the question, guys, ha? Kayo talaga. Para minsan, okay. Francis, listen to the question first before you answer. Francis.
Sir,
Wait lang, Rainiel. Si Francis muna. Which PC of Aspergillus? I know, wala na si Francis. All right, we'll call somebody else. Reniel. All right, Reniel.
Sir Aspergillus flavus po.
All right, well, let's check. Aspergillus flavus. And the toxin that he produces, he talaga, no, lalaki, that the toxin that this particular organism produces is aflatoxin. And you know what? Because of aflatoxin, this is the reason why I don't eat peanuts anymore. This is usually because this particular toxin is very toxic to the liver because it causes aflatoxicosis. Aflatotoxicosis. All right. So the organ that is affected, I've mentioned it before, it's the liver, and if left untreated, it can actually cause liver cancer. All right. So much like any other toxic substance or chemical that you might be exposed to, chronic exposure to aflatoxins can result to can result to cancer. Okay, and in this case, liver cancers. All right. So that's one of the reasons why I don't eat peanuts anymore. And you will see a lot of things that I don't eat anymore as we go along, especially for the mycology, especially for the virology class later on. All right. What was that one? Oops. Oopsie. Where was that? Aflatoxin. All right. So organ affected. Now we're going to move on with how can humans acquire or how is toxin transmitted to humans? It's basically through ingestion. Okay. Infected peanuts, rice or maize. Okay. And ingestion of animal products that have been or animal products from animals that have previously acquired the toxin. So for example, you ate fried chicken from I don't know a Jolly Towel rather, with that has been exposed to to the virus the toxins of Aspergillus flavus, then you might suffer the effects of aflatoxicosis. All right, you might. Now, let's move on to cryptococcosis. Cryptococcus neoformans is the causative agent of cryptococcosis, and the organ system that is affected by this disease is what? Anybody from our wonderful chat room? I've given you guys a lot of time. Uh-huh. Francis Alipio raised his hand. All right, Francis, what is the organ system affected by the disease? Cryptococcosis.
Liver po, sir.
Liver. Unfortunately, that's the wrong answer.
Ah,
We'll try with
I apologize.
Jamema. Ana Jamema.
Lungs, sir, and CNS.
All right. Okay, primarily the CNS, but I would accept the lungs also. Thank you so much.
Okay.
CNS, Rona Lisa answered. Thank you so much for the participation, everybody. You will be given a jacket sometime in the future. Charing. All
Thank you.
right. The reason why it's called the reason why it affects the reason why I ask this question is because you will get fungal meningitis in some of the questions. Okay. Um, I remember in a question bank in 2010. It was a very long time ago. I know. I'm old. I know. Um, a question came up in the question bank and I didn't know actually. They gave me a list of organisms and Cryptococcus neoformans wasn't one of them. So I just guessed. But there was a none of the above question. And I didn't know at the time which one was the one that causes fungal meningitis. And now I know that it is primarily caused by Cryptococcus neoformans. So please don't make my mistake. Don't commit the same mistake that I made in the past. That's the reason why I put it here. Please, 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 please put a star on this particular slide because this one is important. It is usually asked in the exams. Okay. Cryptococcus neoformans is a monomorphic fungi and it only exists as what? All right, let's start ask questions from our lovely audience members. All right, who can answer this question? Cryptococcus neoformans is monomorphic. Therefore, it can exist only as what in the human body? Anybody? Okay, Anna, for the win. Charing. Anna, okay, you raised your hand.
Joke lang, sir. Hindi ako sure sa sagot ko.
Sige lang, push lang. O sige, go, push. Anek. Ano ang answer natin? O, nagtagalog na ako. What is the answer? What is your answer, Anna? There are only two
It can
choices.
exist as yeast po. Yeast.
Yeast, very good. Okay, so it's monomorphic. Yes, correct. O see? Sometimes your answers are correct, and it doesn't matter. Don't worry. The the mistakes that you commit would be something that you can learn from. Don't worry about it. This is not graded. But I would like to announce that I think next week, is it correct, Sir Marco? If I'm not mistaken. Is Sir Marco still there? If I'm not
Yes
mistaken,
po.
I'll still be there. I'll still be there seminar in their seminar class next week, right? Correct, right? I forgot the I forgot the dates.
Yes
Yeah.
po.
Okay, so until I saw now. All right. So I'll be with them for a very long time. And next week I'll be giving away a prize. I'll be doing a
Hanggang
contest.
December
I
4.
know, right? I know. So I'll be doing a contest next week. Is that all right, Sir Marco? Because usually even in my other seminars for you guys, if it's okay
Sige sir, no problem
yeah,
naman.
it's just load. Don't worry about it. All right. Sent via GCash. Anyway, all right. Anyway, I'll be doing a contest next week, so I hope you guys will be able to answer the questions. Okay. So I'll be sending, I think, 500 GCash. Last time somebody won 1,000. Rainiel said something. All right, Rainiel, they might not be able to connect. Okay. Yes, it is actually a game show. I treat this seminar as a game show actually. All right. So next week I'll be hosting a little maybe a 5 minute or 10-minute discussion, a 10-minute contest for people who want to participate, and it's done via this platform as well. All right. Okay. All right. All right, Rainiel, I'm hoping also. But anyway, let's move on to our discussion. So please, guys, if you have time, try to answer some of the questions as much as you can, because the questions that I'll be asking in the contest will be coming from the lectures that I'm giving. All right. Okay, so next, most important virulence factor of Cryptococcus neoformans. I've already mentioned it yesterday. It's the capsule. All right, the function of the capsule is that it prevents
the fungi or the fungus from being phagocytized. All right, and another one is that it's able to undergo antigen switching. So even if the organism is capable of even if the organism is ingested or phagocytized and undergoes the normal acquired immune response, unfortunately, because of the fact that it can switch its antigens, the memory B cells will not be able to produce antibodies against it, and therefore it will not be able to neutralize the organism. Okay, so that's one of the things that causes its viral that causes the virus that causes the fungus to become more virulent. All right. Now, staining technique that is useful in the diagnosis of cryptococcosis. All right. Who is capable of answering this question for me? Um, let's look at some of the people in the chat room. I'll try calling out some people. Staining technique that is useful in the diagnosis of cryptococcosis. Let's try with who's here? All right, Charisse. All right.
India ink po.
All right, wonderful. What is the other term for India ink, Charisse? I like her voice. It's very cute. She sounds like an anime character. All right, India ink is known also as what? Okay. Anybody? Can you help her out? Don't worry, we're trying to do the Bayanihan project here. Somebody raised his hand. Adrian.
Sir, ano po, literacy.
All right, wonderful. Okay, we can move on now. Okay, so cryptococcosis. All right, oval. The appearance would be an oval yeast surrounded by a clear halo. I've already shown it to you guys. Black background, yeast cell in the middle, surrounded by a clear halo. So those are your keywords: halo and oval yeast. All right. What stain may be used to demonstrate the presence of the polysaccharide capsule? um, we have Hucker, no, not Huckerman, Musi Carmine rather, not Hucker. Sorry, I was thinking of a different stain. Musi Carmine, and using Musi Carmine, uh, Musi Carmine will stain the polysaccharide capsule of C. neoformans, and it will stain red. Actually, it will stain red. So in India ink, it won't stain the capsule, but using Musi Carmine, we can demonstrate its capsule. All right. The appearance of Cryptococcus neoformans in CSF sample when it is gram stained will appear as what? I mentioned it yesterday. What's the appearance, guys? Try again, try challenging yourself. Try to remember what I've said yesterday if you can. Anybody in the group can answer. It's okay if you looked at the slides already, but I think it would be preferable if you tried your best in remembering it. Okay. What about the people who raised their hand previously? What about who was the one that raised her hand earlier? It was a girl. Rona Lisa was a girl who raised her hand earlier. I think you were the girl, orange collar one. Rona Lisa, are you still here with us? All right, nobody. Okay. So I'll answer it for you guys so as not to burden you so much. We're going to go with what? The gram stain appearance appears as starburst. This is actually seen in your books, in your AUBF books or analysis of urine and body fluids. Okay, so starburst appearance. This is from, this is again credited from Pathology Outlines. Okay, and I do not take full credits of this image. Okay, which population of immunocompromised individuals are at risk of suffering from cryptococcosis? Why did I of cryptococcosis? All right, whilst I'm typing cryptococcosis, can anybody answer? Cryptococcosis.
Which population of immunocompromised individuals? I'll give you choices. First choice is elderly patients. Elderly patients. Second choice is DM patients. Third choice is AIDS, HIV/AIDS patients. HIV/AIDS patients. Last choice is anybody. Anybody with low WBC count. All right, answers. Anybody can answer in the chat. I just want to see if how many people can answer the question. This question. Third choice. Third choice. First choice. For elderly, question mark. I don't like question mark in the answers, Adrian. I want you to be sure. All right. Okay. Third choice, third choice, third choice. A lot of people answered the third choice. HIV patients, is it correct? Let's see. Okay, we'll see. The answer is HIV/AIDS patients. Okay, these are the common people. These are people who are commonly affected by cryptococcosis or have poor prognostic result for poor prognosis na lang para hindi ako mahirapan. Nagdugo na ako mag-English. Chari. Let's move on with monomorphic yeasts. A monomorphic yeast that is the most common cause of oral/genital infection. The most common cause of oral and genital infection. I think a lot of people when I was studying, are making jokes about this particular organism, and I hope people in the chat can help me out here. All right, you can chat your answer. What is the answer for that particular question? Candida species, all right. Not very specific, but okay, we will try to accept it. Okay, Adrian answered Candida. Let's try to see. Candida albicans, actually. There are a lot of Candida species, but Candida albicans is the most common for oral/genital infections. Basically, if the choices were given and Candida is there, I would give you a correct answer. But if all Candida species are there, because you have a lot of Candida, Candida tropicalis, Candida, there's a lot actually. And biochemically, they can only be identified by biochemical means. However, because Candida albicans is amazing, we are able to see it as a yeast in the human body. Even in the urine, we can see it in the urine. Analysis of urine and bodily fluids review question: which species of um, of of fungi are usually seen in the urine? You can all automatically please answer Candida albicans. All right. At room temperature, Candida albicans appear as a single-celled yeast, but at body temperature, it produces what you call the pseudohyphae, or what we call the germ tube. All right, and there's a test that we use for germ tube to demonstrate the pseudohyphal structures of Candida albicans. Can anybody still remember the germ tube method or the germ tube test? What reagent do we use? And anybody can still remember from yesterday's lecture, laboratory techniques, slide 103, I think. I'm not sure. Somewhere around 100, some like that. Anybody? What is the test that we can use to demonstrate the germ tube? Or can anybody remember how to do the germ tube test? I mentioned it yesterday. Anybody? Let's try calling in other people. I want to see how participative people is. Um, who answered the correct one last? Let's try with Myra. Myra, hello. Are you in the line? Chari.
Hello. Yes,
Taray,
sir.
lakas maka ano ng mga disc jockey. All right, Maria, you're in the line, right? For 500 pesos. Chari, 500 wala, joke lang to ha. For next week na yun. Next week na yung 500 pesos. Practice lang. Myra, do you still remember how to perform germ tube method? The germ tube test.
Ang naalala ko lang po, sir, yung chip. Hip serum
Aha.
gumagamit.
Sheep serum, mahal naman ang sheep. Pwede bang human, yung human serum, pwede bang serum ko ang
Yun
pwedeng
din,
gamitin?
sir. Human.
Pwedeng
Human or
gamitin ang
chip
serum
serum.
ko? O, di ba? All right, then how do I do it? Let's try another person. Um, last person who answered correctly, uh, Adrian.
Yes, sir.
All right, how do you perform? Okay, so she said she needs human or sheep serum. All right, then what do I do to demonstrate the appearance of germ tube?
Um, you will use a pipette po.
Uh-huh. All right, of course, because there's serum.
Then to
All
touch,
right.
to touch um, the colony of the yeast po.
Uh-huh. Do I do it directly on the plate or should I put it on a test tube?
Um, you will put it at on the test tube po.
All right, wonderful. And then how many hours should I incubate it? I mentioned it yesterday.
Um, for 2 to 3 hours.
You just missed by 1 hour, but it's okay. 2 hours is enough. Thank you so much for answering. Lovely. Thank you, guys.
All right. Thank you.
Bigyan ng jacket yung dalawa. Thank you for participating. I love it. Okay. Now let's move on to the easiest way of easiest way to identify candidiasis is through culture or germ tube demonstration using human and sheep serum. So germ tube, you basically just get an inoculum of the organism. That's the reason why I put culture first, because usually they appear in this particular yeast, particularly this particular yeast appears in the urine culture. All right. So um, for us to differentiate it whether or not the organism is pathologic, a great screening test is germ tube is the germ tube demonstration, and quite easy. You can get samples from clinical chemistry or from other departments. Just put a couple of drops. If I were to be much more technical, get 1 ml of human serum, add your inoculum, incubate it for 2 to 4 hours, and then observe under the microscope if there's germ tube formation. All right. And I won't show the picture here because I'm more focused on the Philippine board exam. But basically, the appearance of a germ tube is that you have a single yeast. It looks like it has hyphae, but it's not really hyphae. How do I know it's not hyphae? Because there's no segmentation, there is no branching. Basically, what they appear like is that they appear like extensions of the mother cell. All right. So Candida albicans thrive on high sugar level environments. Therefore, patients with what condition are at risk of developing candidiasis? Again, this is another clinical. I hate asking clinical medtech students, but it's a must, especially for Candida. So I will give you guys 10 seconds to type the answers. Okay, to type your answers. No choices because all of the clues are there for you. Candida albicans thrive on high sugar level environments. Therefore, patients with this condition are at risk of developing candidiasis. Answers, everybody, it's just 2 letters. You can use 2 letters. Okay, all right. Okay, somebody answered complete. All right, all right, all right, all right. Okay, so a lot of the students they know this. Okay, so diabetic patients are actually at risk of developing candidiasis. All right. Okay. Can men have genital candidiasis? Of course. All right. Men have can men have genital candidiasis? Yes, of course. These are usually called in other countries as yeast infection, just to hide the just to hide the embarrassment. So a patient has a yeast infection, and then you look at the chart. Oh, the patient is male. Yes, it can occur. All right. Now we move on to another one, another organism. This is known as a This was recently classified as a yeast. It was previously known as a protozoan. What organism am I talking about? This is Pneumocystis jirovecii, previously known as Pneumocystis What is the previous name of Pneumocystis jirovecii? Or jirovecii, sorry, jirovecii. Previously, it is known as what? Anybody know? For house and lot and entry to the Big Brother house. Ana Jamema. House and lot talaga, oh. Nag-raise talaga ng hand.
Pneumocystis
Nag-raise talaga
pneumonia
ng
po.
hand si Ana Jamema.
Ay,
Yes, very good. Correct. Pneumocystis carini. Alright. Adrian, hindi ka pa rin talaga na ano, hindi ka pa rin talaga natuto sa akin. I want complete answers. Adriana, I want complete answers. If you are going to answer, I will not accept it unless it's correct. Kahapon ka pa, Adrian, sumasobra ka na sa akin. Charing lang, charing lang. Char lang. Char lang. All right, let's move on to the next one. So it was previously known as Pneumocystis carini. All right, I don't have a lot of things to talk about Pneumocystis carini, and except for AIDS patients. They're usually the stain we use for the patients with AIDS to screen for Pneumocystis jirovecii is your methenamine silver stain again. Again, I will go back to your laboratory questions. What is the color of the background for slides that were stained with methenamine silver? I showed the picture earlier. Francis, nice of you
I
to return. The
yes
color of
sir.
the background.
Apple green sir.
All right, apple green. You could just say green. Don't worry. What about for
Green.
fungus? What about for a fungus? When a fungus is stained with methenamine silver, what does it look like? Please describe it to me. One, two, three. Anybody can answer? Oh, somebody raise their
Black
hands.
with a
Black
black
with
with
a
pink
black with a tinge of you.
pink.
I want the complete answer, but it's okay. I'll accept that one. Thank you, Mayra. All right. Now let's move on with the appearance of the yeasts that are of the yeast phase of Pneumocystis jirovecii. Sorry. What does it appear like? It appears like saucers. So it's like you're having tea, okay? Teacups. They look like teacups. Do they look like teacups to you guys? To me, I don't see it. Or saucer cups. They call it saucer cups. It doesn't look like a saucer cup to me, but whatever. That's their discussion. That's how they identify it. All right, and they usually present it. I remember this was asked in our during the year when we competed for the PASMET quiz show. PAMET quiz show. PAMET quiz show. They asked this question. Which of the following is found in AIDS patients? The appearance of this organism, the appearance of this protozoan. It was previous. You would know how old I am because it was still known as Carini. All right. The appearance of this organism when stained with methenamine silver nitrate is saucer cups. It's usually found in patients who are suffering from AIDS. Then they send a lot of questions: Isospora belli, Cryptosporidium Chorva, and then this was the one that they added. All right. So back then we had no idea what this was because I was still a third year student. I had no idea what it was, but it was amazing. All right. So I guess that's the last part of our. Um, I guess that's the last part. Oh, last part of our discussion. We're gonna move on with the last organism in the last topics of our organisms. I have visitors. I have a lot of visitors today, and we're gonna talk about Rhizopus and Mucor. All right, and these are the causative agents of mucormycosis. All right, so mucormycosis is caused by Rhizopus and Mucor. And the clinical conditions associated with or the clinical conditions that are at risk of developing mucormycosis is again
patients with diabetes. A lot of patients with diabetes will suffer from the effects of a lot of the microorganisms or specifically fungal infections that we're going to talk about. And DKA particularly is patients who are suffering from diabetic ketoacidosis are especially at risk for mucormycosis. Why? Because these are organisms that thrive on high ketone levels. All right, they thrive on high ketone levels, especially for patients who are chronically ill with DM. Thank you for the food, guys. I have visitors. I have visitors. I'm terribly sorry. I have visitors during my lecture. Terribly sorry, guys. They gave me a cup of tea. What is this? They gave me a cup of. Oh, all right. It's Arabic coffee. Okay. They gave me a cup of coffee, so I'm terribly sorry if somebody was noisy at the background earlier. Hopefully, it wasn't that distracting for you guys. So those are the organisms that you're going to talk about. We're going to talk about. So DKA, opportunistic fungi that is often mistaken for mucor and rhizopus is Aspergillus species. How do we differentiate them? I've mentioned before that Aspergillus species have septated hyphal structures at 45 degrees angles, whilst Rhizopus or Mucor, their hyphal structures are at right angles. Or when I say right angle, what is a right angle ba, guys? Geometry. Ang daming pwedeng pag-aralan, no, guys? Bakit isinama pa ang geometry uh, sa ating mycology? 90 degrees Celsius ang septations at saka yung angles ng mga branch ni Rhizopus and Mucor. So please don't forget them. 90 degrees Celsius tuloy. 90 degrees angles for Rhizopus and Mucor. And they have the same structures, but they are septated. All right. Then they are also septated. Okay. The common cause of black mold for your bread is actually caused by Rhizopus, specifically Rhizopus stolonifera, sorry. Nangongo tayo. Stolonifera. All right. And I guess that's the end of our lecture about mycology. Before we begin our lecture on virology, I would like to present a case study first. These are case studies that are often asked in the board exam. Bye, guys. Nagbabay yung mga ano ko, mga bisita ko. All right. So these are cases that are often presented in the board exam because I think the examiners have no clear view of our job. I think they think of us as pathologists or as doctors, and they would often put one or two case study files in our exams. So bal was taken from an AIDS patient, sorry, and routine microbial stains were noted. When routine microbial stains were done, and it is noted that in the patient's gram stain indicate a gram-positive branching septate hyphae with angular branching. What organism may be considered? Can anybody answer this one? Or you guys would like to take a break for a while? This is a question that I will pose for you guys. All right. Anybody can answer, or we're going to take a 30-minute break because I have coffee. All right. Hello?
Break po.
I will post this question and I hope people will be able to answer the this is your challenge for today. Okay? 30 minutes
Sige
because
po.
it's lunchtime here. All right. Don't worry, babawi ako sa inyo next week. Wala ako sa hospital next week. Sir Marco, since madami akong binibigay na break sa kanila, would it be possible if I would extend like a couple of minutes next week if it's okay with you?
Sir, wala namang problem sa akin. Nagbabantay lang naman ako.
Okay, sure. Thank you so much. Babawi ako sa kanila eh. Babawi ako
Okay,
sa
sige
kanila
na
kasi
po.
ang dami kong break sa kanila this week. So next week, and since kasama ko sila hanggang December pala, aabot pa hanggang birthday
Oo,
ko. My
oo,
gosh.
makakapag-banding pa kayo.
Oo, makakapag-bonding pa tayo. Then, yun nga. All right. So, this question will be posted on this meeting, and when I come back, you have 30 minutes to answer these two topics, these two case files. The other one is longer, and I like the case study too, but we'll answer those two later. We'll answer these questions later. All right. A traveling vlogger came to the ER with complaints of cough, night sweats, difficulty in breathing. Prior to the onset of symptoms, the patient went to the wilderness, following the migratory patterns of fruit bats. A week later, the symptoms began to appear. Blood work was done. Leukocytosis and slight anemia was noted. Blood smear shows fungal infiltrates in the neutrophils of the patient. What is the most likely organism? So those are your two questions. So this one is very close to our hearts because a lot of people want to become vloggers. All right. So study number one, Bal from AIDS patient, and the other one is the case of a traveling vlogger. So when I come back, we're going to answer this one, and then we're going to move on with with the other topic, which is virology. All right. And I'll be sending Sir Marco the question. And for replays of this lecture, you will get it in the link provided below. All right. And if you guys don't mind, try to subscribe. Charing! All right.
Sir, by the way pala,
Sir?
sir, yung lecture na sinend nyo daw is kulang pa din.
Kulang pa din? Tapos na yun ha, oy. Nakakalurky.
Yes po, sir.
Yes,
Kulang
sir.
194
Until
lang po. Hindi pa po
194
kasama yung
lang
virology
yung
po.
Yeah, hindi ko talaga sinama yung
An-
virology kasi baka
hindi.
unahan nyo ko. Paano
Sir,
tayo
from ano po,
makakapag-
slide
Ah,
194, hanggang slide 194 lang po. Tapos, yung succeeding po, hindi po kasama.
yung sa lecture ko na ngayon.
Dito po sa Mycology. Yes po.
All right, wait, let me close this